In a city where health is paramount, where every citizen's well-being is a priority, and where progress in healthcare is not just a goal, but a relentless pursuit. Welcome to the Iligan City Health Office Accomplishments video. Since its inception, the CHO was always committed to providing quality healthcare to all constituents of Iligan City. Since 2022, in preparation for universal healthcare, we've upgraded several of our offered key services, expanded our reach, and strengthened our capabilities. We introduce the rise of a new Iligan CHO. Since the beginning, the CHO has stuck to its mission to provide healthcare to Iliganons in all levels. Access to maintenance drugs, maternal health guidance, nutritional counseling, family planning, and dental services at the barangay and city level have always been available due to the untiring commitment of our barangay health workers, midwives, nutritional scholars, nurses, and dentists. Today, this access has been boosted with the advent of new programs, shortening the distance between healthcare and the Iliganon citizen. The Serbisyong Iliganon Caravan, the brainchild of the CHO administration, has delivered LGU services including public health closer to you. In partnership with the City Mayor's Office, the CHO has brought doctors, dentists, skilled and trained nurses, and medications to the doorstep of different barangays twice a week, all free of charge. O Plan Visita, another project of the CHO administration headed by Dr. Charles Marquez, has delivered doctors for consultation and essential medication for bedridden and disabled Iligans in need of our health services. Never before in history has the CHO been closer to you. With 7 geographically isolated and disadvantaged barangays, delivery of services to these areas have been a mainstay trial to any public health worker. Since 2022, the CHO, through the efforts of district officers and their teams, has increased the frequency of medical visits to these far-flung areas, making sure that even the farthest of Iliganons can exercise their right to health. In 2024, Dr. Benegrado and his team has been welcomed as the first medical team to ever reach Sitio Banyugan of Barangay Rogongon, 64 kilometers from the city center and 118 meters above sea level. A perfect example of the CHO's commitment to serve each and every Iliganon. Before 2022, the City Health Office's activities and programs have been carried by only 7 medical officers. With increasing urban development and progress under this city's administration, Iligan's population is projected to reach 380,000 this 2024. In the advent of a new Iligan CHO, 22 doctors now serve under the Iligan City Health Office, bringing down the patient load of each doctor to 16,000 Iliganons, way below the 1 doctor per 20,000 patients recommended by the World Health Organization. With more doctors, nurses, and midwives, the CHO can now cater to more patients from all facets of life and in all levels of health. With more efficient data collection and smarter decisions, the CHO has been able to curate and update its drug formulary to the latest recommendations. The CHO pharmacy now carries new and stronger antibiotics to cater to growing antibiotic resistance. Included in the formulary are expanded drug options for our patients, especially elderly citizens requiring more specific therapeutic options. This is, of course, trickled down into the barangay level for easier access. From the analog and limited diagnostic services reliant on microscopy and manual counting, the CHO laboratory has expanded its offerings to include more essential diagnostic tests, such as creatinine, lipid profile, and liver enzymes. With costs partially subsidized by the local government and PhilHealth, basic and expanded diagnostic tests have never been more accessible to the public. Cat got your tongue? Anxious about a dog bite? The CHO's got your back. With increased funding to the Animal Bite Center, the CHO has finally been able to offer free anti-rabies and anti-tetanus post-exposure prophylactic vaccinations. This privilege has been extended not only to long-term residents of Iligan, but also to students and workers enrolled and employed in the city. The Office of Senior Citizen Affairs established the Iligan Elderly Clinic back in 2016. Suffering from a lack of funding, medications, and services, maintaining a high quality of care in the clinic has been a challenge to its providers. Since then, the OSCA has strengthened its partnership with the CHO, increasing the number of doctors on duty per day and expanding available drugs in the dispensary. Now, the Iligan Elderly Clinic is able to cater and supply for a variety of cases, from cardiovascular diseases like complicated hypertension, chronic chest pain, and heart failure to diabetes complications. Barangay health centers are the foundation of Filipino public health. Relying on fast and efficient barangay health workers, the City Health Office has continuously had its presence felt in every household. Knowing this, we've strengthened our foundations and deepened our roots. True to the spirit of universal healthcare, we've established 5 PhilHealth accredited consulta centers in barangays Palao, Tibanga, Dalipuga, Luinab, and Maria Cristina, and 1 Super Health Center in Digkilaan, paving the way for increased access and better quality of care. Expanding from its vision as a premier healthcare provider, Iligan City pushes into the future as the first city in northern Mindanao to commit itself to the Smart City Initiative, and with it, the unwavering goal of smarter healthcare. In the face of universal healthcare, smarter decisions must take front and center. The CHO's reliance on manual data collection, analysis, and unorganized reporting has led to wasted data, inefficient validation, and poor visualization. Now, the CHO has joined the Department of Health in digitizing these efforts. With locally brewed applications and national-level innovations for data reporting, we have successfully lessened the analog burden on encoders, isolating manual processes at the barangay level. This allows the City Health Officer, program coordinators, and district officers to make faster and smarter decisions. Since 2023, the CHO has started on the road to smarter healthcare by subscribing to electronic medical record services and health information exchange platforms. Since then, the CHO is slowly expanding its digitalization efforts to all health centers in the city for continuity of care, more secure data storage, and faster referrals. As of recording, we have distributed over 15 desktop computers and printers to health centers and garnered commitments from barangay officials to connect them to the internet. The City Hall Consulta Center is now fully digitalized under CareSpan PH, allowing faster and more efficient PhilHealth claims. All of these progress happening while we garner award after award. What is the future of Iligan healthcare? Through the continued expansion of EMR use in all health centers, public and private, and with the completion of the city's local health information system, you can expect any healthcare provider in Iligan to have all the information they might require to give you the service you need. In the future, telemedicine will be accessible in all barangay health centers, even in the hinterlands. Capable midwives and nurses will be able to connect any patient with a doctor remotely for more complicated cases. In the near future, the establishment of an online referral system for local health providers will allow faster referrals to specialists and hospitals, no longer relying on patient effort to schedule appointments and consults. With this extension of care, we expect greater populations served. In the future, the Animal Bite Center would have a separate building, accredited and able to provide services, still free of charge. The elderly clinic would be turned into a multidisciplinary institute capable of addressing all geriatric care needs. The CHO laboratory and pharmacy will continue to expand, with tests and drug formularies influenced by data trends, making sure that no cost is wasted. In the future, the CHO would truly be paperless with an AI-capable administrative building running on effective health informatic data. Every decision will truly be reflective of reality. This is the new Iligan City Health Office. Join us into the future.